Hi everyone, my name is Soraya. Welcome to my YouTube channel. My YouTube channel is Thureya Star Star Star. It talks about skin health and wellness. And today we'll be talking, as you see the topic, we'll be talking about osteoarthritis. And if you have seen my previous videos, please like, subscribe, and share. If this is your first time watching the video, welcome. And if this is a topic that is interesting to you, continue watching, and please put a comment below if there's anything that you would like to state or to explain or to share with everyone. So yeah, today we're going to be talking about osteoarthritis. So arthritis is the swelling of the joints, mainly due to inflammation, and this causes pain in your joints. There are different types of arthritis. I'm not gonna go into all of them. There's, osteoarthritis, there's rheumatoid arthritis, there's arthritis because of infection, there's gout arthritis. But today we're gonna be talking about osteoarthritis, which is an arthritis, as it says. Osteo deals with the bones and the joints. So it has something to do with that, which is causing the arthritis. So osteoarthritis is the breaking down, it's a chronic disease which is due to the breakdown of cartilage in the joint area. And this chronic breakdown of cartilage causes like erosion of that joint, and it causes the joint to lose the space and the fluid in between the joints, which makes it easy for the joint to move back and forth in your regular walking and activities. So it causes pain, it causes swelling, it causes warmth and redness in the joints. You may feel like, because of that inflammation, apart from the pain, you might feel like the joint is warm, it's tender to the touch. Sometimes because of the inflammation, the fluid fills in the spaces which are in the joint, causing swelling, and the swelling causes pressure in the joints, which makes it even more uncomfortable. Sometimes it might not be like swelling, it might be stiffness. The joint may feel stiff. You're not able to fold or bend your knee or bend your elbow, because there's that accumulation of things which should not be in the joint, so it causes that stiffness in the joint area. Or sometimes it's the fluid itself which is causing pressure, so that you're not able to move the joint, so you feel joint stiffness. So you feel joint stiffness, and there's a limited movement, you can't do a whole movement with your arms or with your legs. So what causes arthritis, or rather let's say osteoarthritis? What causes osteoarthritis? Most of the time it's hereditary. If you have a history of the family having arthritis, you're most likely to have arthritis. It's also related to obesity, and increased work on the joint, increased pressure on the joint causes that cartilage to break down, or it causes an inflammation in that area, which causes the cartilage to break down. It might be due to injury. For example, if you're doing sports and you keep hurting yourself in that joint, that may cause a break in the cartilage, or meniscal tears, which cause the cartilage to break down. I'm gonna put a picture of the joint actually, so that you guys can see what I'm talking about when I'm talking about the joints, so that you can just have a picture of what I'm talking about in terms of the joint space. But yeah, so that increased injuries can cause you to have, or increased mechanical activity with your joint. For example, if you're running, that increased knee overuse, I would say that's another cause. There's injury, and then there's overuse, you're using your joint too much. For example, if you're typing a lot, or if you're running a lot, this can cause the joint to be inflamed and cause that cartilage to break down. As a healthcare provider, you're standing a lot, you're lifting weights, all of those things cause wear and tear on your joints, and that can also lead to osteoarthritis, especially if you're doing it for a long time. I'm sure you have either yourself or maybe a family member who has had osteoarthritis, and the main thing they'll tell you, oh, I'm feeling a lot of pain, and the pain can be really excruciating. Like you can't move, you can't go to work. It can be really severe, but we don't want it to reach a severe state. So if you have like a feeling that you're having the osteoarthritis, you're having like some pain, some swelling, then maybe you should think of how to prevent it from getting worse. As I said, sometimes it's hereditary and you cannot really do anything much about it, but if you can identify it earlier, then it's better to start doing something about it now, because as I said, it's a chronic disease. So it's something that you'll have to take time, a long period of time, to prevent. And the worse it gets, the harder it is to go back to like your normal self. Like it's like aging. Once you become older, it's harder to go back to how you looked like when you're 14 years old. It's like irreversible, but the more you do things to maintain like a healthy life, a healthy skin, a healthy diet, then the more you look maybe a little bit younger with age. So you just have to maintain your joints better as you age. So once you have identified that I think I might be having osteoarthritis, or I might be doing something that may be causing pain in my joint, then what should you do? I talk about prevention, and prevention will help you prevent a lot of things, or like medication which you may not necessarily need, or it might prevent you from not being able to do that job that you really want to do. So I really advocate for prevention. So what can you do if you think you have osteoarthritis? Mainly, if it's something you think is due to your weight, then you have to maintain a good weight. If you think, oh my God, for example, people realize that when they gain weight, they have more trouble with their joints. So obviously you need to know that you have to maintain a good weight for you to have like less pain with your joints, or like just improve your joint health. So if you can, then I would recommend a healthy diet. First of all, diet is usually the first thing, so that you can lose the excess weight. And then exercise, as I have mentioned before in my previous videos, you need to do like movement. Sometimes movement can worsen the joint, but you have to do movement in a way that it's not too much, but it's not too little. Like you can't be what do they say? Just sit on the couch. You have to do some movements while you're sitting. For example, I can just do this, and that is helping my joint notice that there is some movement in that joint. So the body notices that movement and says we have to maintain that joint because there's some movement going on there. It not only, that activity of movement does not only affect your joint but your muscle too. So it knows that it has to maintain the joint and the muscles around that joint so that it stays stable. So you have to do some movement. You can do just your range of movements, which is a passive range of movement, like you're not really standing or walking, you're just doing it like while you're sitting. But you can also do active range of movement, that is if you're able to run, jog, and you don't have to do it for too long, but at least do some kind of movement. Walk within the house, do your house chores, climb the stairs. Another movement which is very good, especially if you already have osteoarthritis, because running, especially running too much if you have osteoarthritis, may worsen the joint, is swimming. So swimming is like non-weight bearing exercise. So when you're swimming, you're able to move your joint, but the joint doesn't realize or doesn't notice that there's weight. So the joint is able to move much better and easier while in the water than while you're like on the ground. So swimming is a very good exercise for those people who have osteoarthritis or even rheumatoid arthritis, because it helps to ease the pain while still doing activity on the joint. In terms of diet, you need to take something which has calcium, which has something that will build up your cartilage, and which has minerals to build up your cartilage and the bones and the muscle. So you have to take something with calcium, and that's usually dairy most of the time. Depending on how you like your dairy, if you're able to take whole dairy, fine. If you're not able to take whole dairy, you can take a low fat dairy, but dairy is good for calcium. If you're not able to take dairy, then you might need a calcium supplement for you to maintain your joints. Another tidbit while I'm there, when I'm talking about calcium, is for women who are menopausal. They lose calcium from their bones so much faster because just because of hormone changes. So they do need probably a calcium supplement. It's good to ask your doctor. They can do some tests to see if you're losing your calcium and if you need a calcium supplement. But it's just good for you to know that as long as you're menopausal, especially if you're a woman, this calcium from your bones gets, because your body is always in a place of trying to keep things normal within the system. But because of hormones, when you're menopausal and you're losing this calcium, the hormone changes make you lose the calcium. It realizes there is less calcium in your body, and then it uses the calcium from the bone to maintain the calcium in your blood. So there's a constant cycle of loss of calcium. So that's why you need an extra calcium supplement to maintain your blood calcium. So keep that in mind. So you need a calcium supplement, you need something for the joints, which I'll talk later in the treatment, but you need something which has glucosamine and chondroitin, which are the things which maintain your cartilage. And then also minerals, so things from your vegetables, water, vegetables. The dairy also has minerals, meat, proteins. So you have to just have that balanced diet, especially things fiber, vegetables, dairy, and meat are things that will help you maintain mineral supply in your bones. So apart from the diet, you can also take omega-3s, also helps your joints keep supple. Vitamin D and magnesium. Also, you can ask your doctor how much you need, but most of the time, especially if you're in developed countries where even not developed, even they have to be developed countries, but most likely if you're experiencing winter, you may not have enough vitamin D in your system, so you do need a supplement for the vitamin D. And most people also need magnesium supplements because they don't get enough from their food. So yeah, so you need to keep abreast with your multivitamin supplements. If it's related, you think it's related to work, you might have to reduce your activity, have the doctor maybe examine, do x-rays, and see if there's something that they can do to either, sometimes you might need a splint or a brace so that you're not damaging the joint so much. You might have to reduce your weight, how much you carry, your weight restriction while at work. If it's running or activity, you might have to slow down on the running for a little while. That's why you see sometimes athletes, when they get injured, they have to slow down before they go back to their regular running activities. And you might have to rest the joint for a little bit. But while you're resting, as I said, you must also do some type of activity. Unless the doctor tells you not to do it, then just keep your joints having that minimal activity so that it doesn't become stiff. Also, you have to keep hydrated. Make sure you're taking enough water, enough fluid, so that you keep the joint fluid in good amounts. Your joints need a lot of fluid so that they keep supple. Apart from the hydration, you can also make sure that you are, if you're able to walk, do some activity. As I said, you can take a walk, go jogging around the block, try and do some exercise. As I said, do your chores, go up the stairs, try and keep your joints in an activity so that the joints are aware that there's some kind of movement. As long as there's some movement within your joints, the body is aware that it has to keep the joints in a good state. So if you don't do any activity, then it's not good. And if you do overactivity, it's not good. You just have to maintain that moderation. What happens when it's severe? Then you might have to go to the doctor. They'll do probably some x-rays to see if there is arthritis, first of all, what kind of arthritis you have, and where it is affecting. Is it affecting just the joint? Is it affecting the bone? Because with osteoarthritis, what happens is when there is that erosion of the cartilage and the bone, what happens is that the body tries to make new bone so that it can replace the old bone, but sometimes it makes the new bone in areas where it can cause pressure or pain. So that's what the doctor is looking for. The doctor is looking for if there's enough fluid in your joint, if the cartilage and the bone is eroded, and if there's a new bone somewhere which may be causing impingement on your nerves. What they call osteophytes is where like they have new bone formation where it should not be in the joint. So those are the things that they are looking for. If they see anything of that, then they might do an MRI to see if there's any nerve impingement, because sometimes where the joints are is where the nerves pass through, so they might also look for that. If there's something that they can do, if they think they can do surgery, then they'll probably do some kind of surgery. If they think it doesn't need surgery, they might give you like a brace or a support so that you keep the joint in place so that you don't irritate the area. Also, they might, if the joint is swollen, you have like joint fluid accumulation, they might remove the fluid from the joint and do what they call a joint fluid analysis to see is there something else that may be causing the joint to swell or to be inflamed. And as I said, this is for osteoarthritis, but the other kinds of arthritis, so they'll be looking to rule out other kinds of arthritis. So things, if you did not know, this is another tidbit which I had started in the beginning, that arthritis can also be caused by infections, especially like sexually transmitted infections like syphilis. And you can also get arthritis from things like TB. So they might be, and as I said, gout is also another thing that may cause you to have arthritis. So they look for all those things. Also some, I think, autoimmune diseases. So yeah, they also look for all those things like autoimmune antibodies and all of those things to rule out other kinds of arthritis. Apart from removing the fluid, they might also, like, if they think it's not like an infection, it's just like an either autoimmune process or osteoarthritis or rheumatoid arthritis, they may give you steroids within the joint to reduce the inflammation in the joint. That's why they give you steroids, because steroids help to stop the inflammatory process. So they might put a steroid or give you a steroid injection in the joint to help reduce the inflammatory process. Unless it's an infection, then they might give you antibiotics. And then also with gout, as I had said, you can eat meat, but with the gout, that's one place where you might be told not to eat meat, because meat causes something like crystals within the joint which may irritate your joint. So that's why for gout you may be told to reduce red meat so that you don't cause irritation in that joint and more inflammation. So yeah, the doctor might do all of those things, and sometimes they do surgery, like major surgery, to maybe like a joint replacement if they think the joint is very eroded and there's nothing much that they can do. We don't want to reach that stage. We don't want to reach joint replacement unless you really have to. So if you can do all the other things before, yes. If it's causing a problem with your movement and your, your life, your quality of life, then you might need to do surgery. So it's always, you have to see what the harm and benefit is. In terms of like diet and natural things that you can take, ginger and turmeric are good things that you can have been noted to reduce inflammation in the joints. So you can add that ginger and turmeric in your food, in your drinks. As I said, also vitamin D as a supplement. Vitamin D, your omega-3s, your calcium and magnesium, and some people take fish oil or shark oil. I've seen that. Of course, with your shoes, or if you're running, things like that, wear good shoes, wear good running shoes. For me, for example, I have a flat foot, and that's just genetic. So for me, I have to wear good shoes that support my foot arch, so that my foot and my joints don't get irritated too easily. So that you might need to see like an orthopedic sometimes. And then also try to maintain your posture, keep your posture straight. I struggle with that. I always struggle with that, but I try. When I remember, I keep my back straight. But yeah, keep your posture straight, keep your joints active, take plenty of water, maintain a healthy diet. If you think you've gained weight, try and lose some weight, and you should be in a place where you can maintain a healthy joint. Also, sometimes a doctor might recommend physical therapy, which physical therapy or occupational therapy is just exercise. They show you how to do certain exercises for certain joints so that you're able to maintain your joint mobility. Yeah, your joint mobility is like you're able to move your joints in certain ways. For example, my shoulder joint, I should be able to lift it, go down, go forward, go back without any pain at all. So they do exercise so that you maintain your joint mobility, that the way it goes round and up, should be able to maintain your joint mobility in all of those kinds of movements. They might recommend that you do physical therapy sometimes, because your joints might be weak or your joints might be stiff, and they want you to have a person who is knowledgeable to be able to help you with those exercises so that the joint doesn't remain stiff, and you can do the exercises at home by yourself. In terms of treatment, also the doctor might give you something for pain, because that's usually the main thing that might cause you to go to the doctor. They'll give you something to reduce the pain and the inflammation, and those are usually what you call NSAIDs, which are like ibuprofen, Aleve, diclofenac, aspirin, all of those kind of things help to reduce pain and inflammation. Usually it would probably be the ibuprofen or diclofenac for the joint pain. But sometimes for some people, they're not able to tolerate this ibuprofen or diclofenac or naproxen, so they might just give you Tylenol. Tylenol just works for the pain but may not relieve the inflammation, but it is an alternative. So yeah, so you might get some Motrin, some Aleve, some ibuprofen, all of that stuff to reduce the swelling and the pain in the joint. Apart from that, as I said, they might give you the steroid to reduce the inflammation. If there's something that is causing it, they might give you some medicine. For example, if it's a gout, I'm not talking really about gout today, but if it's gout, they might give you some medicine to reduce the uric acid in the joint, like colchicine and allopurinol. And also to reduce the inflammation in the joint, they might tell you to use this acronym, which is called RICE. RICE is to rest the joint, to put ice, to compress the joint. So you might have to put like a bandage so that the inflammation doesn't increase, and to elevate the joint so that the fluid doesn't become worse, doesn't become bigger. The elevation helps to reduce the joint fluid moving into the joint. Yeah, they'll use rice. So sometimes they use heat to reduce the inflammation, and sometimes they use ice to reduce the inflammation. So you might get one of the two. And as I said, you might have to rest the joint, ice the joint, compress the joint, or elevate. So that's rice. And that should help for a little bit until the inflammation is sorted out. Try and be careful. Some people have like braces which they use when they are typing so that it reduces that inflammation. Try and moderate that amount of time you're doing certain things. Don't overwork your joints. And then also try and lose some weight. Usually for most people, it's the weight which causes the joints to start becoming inflamed. Just because of the weight itself, it can cause inflammation. And then the pressure on the joints also causes the inflammation. For Some others it might just be like joint deformities, which you can't really help. So if you have like joint deformities, then you have to be more cautious about your weight and your joints. So you may have to take supplements, you might have to wear supports to reduce the inflammation in certain areas. Be careful of what weights you're lifting. If you're like a weightlifter, you have to, sometimes you see the weightlifters, they have to wear something so that their joints are aligned, so that they're able to lift safely. So those are the things you have to do just to be more careful in straining your joints. So yeah, I hope you got something from this little video on osteoarthritis. If you would like any other topics, just continue and comment below. Please subscribe, please hit that notification bell so that you are able to see my videos coming. Please and subscribe. And really, I would like to see any comments in the video so that I know if you are liking the videos. But yeah, I would say if you haven't liked it, please and subscribe. Okay? All right, we'll see you on the next video. Bye.